And we are rolling. What's up, guys? It is Wednesday. I am back home, and I wanted to talk to you guys for a minute about my little visit to the chiropractor. You guys are all familiar with what I posted last week, basically saying that the chiropractor did not go over the X-rays in detail with me, but he did say that it was really good that I was active and the exercises that I was doing. So I'm going to go into detail now exactly because this visit, the second visit that happened today, we actually, he put up the x-rays and we looked at everything in detail. Um, Funny thing enough, as I'm waiting, I've got my Team Beachbody shirt. I came from work, from seeing patients, and I got my Shakeology because I was in a rush, so I'm having this for lunch. And the front desk girl goes, what are the ingredients in that? What'd you mix with that? And I said, actually, this is just water. And needless to say, it turned into a 20-minute conversation at the end, finding out exactly what her goals were, what she needs, that kind of thing. But I digress. So he shows me the x-rays, and on the frontal x-ray, I've got just a slight, what's called scoliosis. And he said, what that's doing is it's just a little bit of an imbalance. A lot of people have it, but it just causes an increased chance of getting arthritis or inflammation in your back. And then he shows me my lower back, which is historically, for those of you guys that know, when I went to just over a year ago, before I got involved with Beachbody, and again, this is not a Beachbody video, but I went to my buddy Sean, who I knew was doing these exercises, and he was all into nutrition and fitness. And I said, Sean, he's a baseball teammate of mine. I said, my lower back has been killing me when I'm pitching, and I need to. I'm like, what do you do? I know you do some of these exercises. Do you've got anything for me? Whether it's yoga, Pilates, something like that. And so he threw Insanity Asylum in my face, which is a sports performance workout. And to be honest with you, one of the exercises that you do one of the days is like a swimmer's move where, I'm on my stomach and I'm like arching my back and I'm kind of going like this. And it was an extreme core and lower back strengthener. But it's funny how that really was the game changer between that and, of course, everything else. My lower back has been, managed. And so he shows me the x-rays, and I'm gonna kind of use, let's see if let's grab these. Okay. So let's say these are your vertebrae. This is the way that it should be. Okay. So let's use, this is the front of you. So this is the front of my body. So you should have spaces like this, and in between is discs. And as your back kind of goes down, the way that my back goes down, because I tend to, Brooke's always saying I arch my butt out. So it's like I end up, it kind of curves in, okay? So because it curves in, it actually, what happens is it's like my two are like this and not like this. So the width between the two vertebrae is significantly narrow in the back, in the posterior section. So what happens is it goes like this. My arch is going like this. And there's my butt, and that's what makes sense why I'm reaching out. So this is generalized. So because of that, the chiropractor said that it's genetic, that you have it's just a genetic predisposition for disc degeneration. And thank goodness that you are so active and that you are eating properly. He goes, and I'll go into detail what each one of those means. So because of the fact that I'm so active, he said, if you were not so active and you were just a couch potato or whatever, you would be not only having much less mobility, but you'd be having leg pain, leg numbness, and you would not look the way that you would look. And what's interesting is I see that like 8 times out of 10, and these are people that feel like they never had a choice. This was just genetic. They had never had a choice. And so then for me to tell them that they all of a sudden need to start moving and everything like that, when already they have so much pain, is extremely hard. So getting people like you before that happens, it's rare, because he was saying that the majority of America, they don't exercise the way that they should, and so, or you'll get all these bodybuilders and stuff where they're kind of breaking down their bones and they don't realize that they need to be doing other exercises for lengthening their muscle stretching besides core strength. So he says to me that the second thing is eating properly. He said, you need to be eating a diet that's high in greens and that is decreasing inflammation in your body. And I'm thinking to myself, well, I just happen to have a thing of Shakeology here, but I didn't. Needless to say, in this last year, I've been eating clean. I've been fueling my body with stuff that is just like super antioxidants and a lot of decreased inflammation. I have not taken naproxen or ibuprofen the whole year. It's insane. And my back has felt as good as it's ever felt. So what are the things? Sorry about that. My my phone ran out of memory. So we're back. The only difference is I got a peanut butter and jelly sandwich and I got a glass of water now because I got hungry in between downloading that first clip into iMovie, which I will mesh together and give to you guys, which is, you're listening to it now, which means you got the whole thing. So where do we leave off? We're talking about the chiropractor. He's talking about the two things, the fact that I'm exercising, eating things that decrease inflammation. I haven't taken naproxen, ibuprofen in a while. And so, that's really helped me. It's funny that most people, like when they get on like their weight loss kick or they start doing something, it's usually because they want to lose weight or they don't have any energy or whatever. And for me, it was really, injury. I really had no idea that I had this a genetic disc degeneration. And I thought that it's been pretty cool that I've been able to incorporate, a lot of these different, and I've been, for those of you guys that don't know, I've been a group fitness instructor with Equinox Fitness for well over, I've been a group fitness instructor for like 13 years, and I've been with Equinox like 6 years. But I teach cycling, and I've done tons of boot camps and everything like that. I think that the difference is that this is a lot more controlled in terms of the form and everything that I'm doing. And by no means, I'm not selling you guys on any of the Beachbody products in this this video. I'm just saying that it would make sense with what are the things that why do I feel better? And it's because I'm doing so many core strengthening exercises. I never did Pilates and yoga before. That's also helping me. So if any of you guys are listening to this and you have some leg problems or some tingling and this and that, now if you're overweight, that in and of itself is just a huge detrimental factor to to your balance, to your spine. It's just too much. There's just too much pressure, too much weight for your body to handle. So that's the first thing you got to get under control as you start to commit to moving. But if you are in shape and you want to avoid that, it's so important to do things that strengthen your core and that stretch you and lengthen your muscles. And guys, I know this, and it's like people are either weightlifters or they're yogis, and they make fun of each other. And if you're one or the other, and you don't do any of the other thing, you're really missing out. I'll just leave it at that. Especially with the meditation and everything that I've gotten with yoga. I used to think it was weird, and now I think it's awesome. So let's see, moving on. So we've got a schedule where I'm gonna, he was very honest with me. He's like, we're gonna loosen up. He's like, I know your schedule's crazy with patients and surgeries. And he says, when you can come in between that and massage, and he said, you really should be getting massages, every week because of how active you are, because you do a lot of standing and surgery. So it's all about working the system. But he did say that, massaging that lower back and my core and my legs, that really does help. And that was good to know. By the way, if any of you guys are in the Prospect, Kentucky area, I love to recommend small businesses and recommend people when there's something to recommend. And this guy, this chiropractor, and I'm around a lot of other medical professionals. His name's Brian Marquez. If anybody needs a chiropractor, I just want to give a little shout out. He has no idea I'm doing it. This guy's awesome. He's really, really, really good, and I'd be happy to, to give you some more information on where he's located in East Louisville. But the guys, I really liked it. He was never trying to sell anything or anything. He was really listening to me. So getting back on topic, afterwards we put the electro-stim on, and I'm gonna see him on Friday. And then of course the woman from the front desk came over and we started talking for like 50 minutes, or sorry, 15 minutes. And this is I'm going to talk just for a minute also. So now we talked about my back and why that makes sense of everything that I'm doing. Um, she started talking. She's like, I've heard about Beachbody and all this other stuff, and everyone seems to be doing some MLM, multi-level marketing thing these days. And she's kind of heard a lot about it, that and so forth. And let me just kind of touch on that, regardless of what your job is or anything like that. I think that there's a reason why network marketing or multi-level marketing seems to get such a bad rap, when really any job can get a bad rap. I mean, just for instance, like a mechanic that sucks, or a doctor with horrendous bedside manner, he's not good. It's very easy. You can get a bad reputation very easily, right? So there's good ones and there's bad ones. Network marketing is really based on relationships first. I mean, why am I a Beachbody coach? Because I dig it. I dig what, it's not, we always say it's not about selling, but I dig the workouts. I like I like taking the shakes. I love the community. I mean, I just dig the community. It really fuels my fire. And I think it's awesome. I love sharing it. And it's important though that it's kind of like a religion. You want to share your religion with people because you believe in those things. Well, that's why, I mean, Beachbody is just cool. To me, it just makes me a better person, and I think it makes other people better. But that being said, don't ever forget, you got to form a relationship with people first, because people don't want a Toyota when they're shopping for a Nissan. You got to find out what people need. When people ask you, and this is for any network marketer, when you got whatever you represent, you're doing it because you love it, because you dig the products, and you think that the service, and you think that it's really going to benefit somebody. And don't ever forget that. You believe in it. Why do you believe in it? What is it doing for you? How has it changed your life? And that's kind of the mindset you want to have with whoever you reach, on the other side. You want to be cognizant and aware that it is touchy. This whole network marketing thing is very touchy because it has kind of a negative cloud over it. And so you just want to care for people. I mean, you do it because it's made you happier or better. You're not doing this because you think that you're stealing anything from anybody. You're just trying to improve the life of somebody else. And so don't ever forget that, first and foremost. And if you remember that, it's going to be, you actually are going to figure out how to talk to people and actually then find out what they need, find out what they want. And maybe, it has nothing to do with what's in the lotion, or what's in Shakeology, or this and that, or what program is better than this. What do they need? What do they need? And what has it done for you? Maybe that'll kind of mesh, and if they trust you, and that comes across in your posture, if they trust your guidance, they'll give it a shot. I mean, these things all have money-back guarantees, whether it's a lotion or a candle or whatever it is. I mean, these things, you got to be trustworthy first and foremost, and that's really what it is. You, the genuine you, is what people want. They don't want the ingredients in the back of the label. So, kind of went off on there. I'm gonna eat my sandwich, and I'll talk to you guys later.